Hi there. My name's Dr. Kim Heinrich and I'm a researcher at Manchester University. I'm also a medical doctor and I look after patients that have arthritis. As part of my job, I am the chief investigator for the Biologics for Children with Rheumatic Disease study. I call it the BCRD study for short because that's a big mouthful. The purpose of this study is to look at the outcomes among children that receive biologic drugs for the treatment of juvenile arthritis. A lot of people ask me what biologic drugs are. Biologic drugs are a special kind of drugs that are defined because of the way that they're made. Traditionally, drugs, which we call synthetic drugs, such as penicillin or other antibiotics, for example, even some of our painkillers, used to be a type of drug we called synthetic drug. And these are made in laboratories by adding chemicals together, usually following a very specific recipe, that produce pills or sometimes other fluids that we can use. Biologic drugs are used using a very specific biological formula where they're actually derived from living organisms. It might sound weird, but these can be things like bacteria, yeast, or other living things. Don't worry, none of that bacteria actually comes into you. But by using this technology, what we can do is make very specialized, targeted medication that specifically focus on one particular aspect of arthritis, in this case, inflammation. They're very expensive, as you can imagine, to make because the technology is very advanced compared to some of the older drugs that we have. These drugs have been around now for a long time. One of these drugs, called etanercept, has been around for almost 10 years. But more recently, other biologic drugs are also being used for children with arthritis. The reason we set up this study, called the BCRD study, was to study the outcomes of these drugs in large groups of children receiving them. When these drugs first get licensed, a lot of children will have received these drugs in clinical trials. Clinical trials are a necessary step because we need clinical trials to prove that the drugs are effective. However, they're often conducted in very small numbers of patients, and sometimes they can't answer other questions, such as what is the long-term outcome of taking these drugs. Clinical trials can tell us whether or not drugs work, but they can't necessarily tell us who they will work in. And one of the goals of the BCRD study is to collect information on lots of different children to understand, in the real world, who's being prescribed these drugs and in what patients will they work. It also can tell us more about some of the safety aspects. So although we know that these drugs appear to be relatively safe, there are concerns, as there are with every treatment that we give, about side effects. And the studies such as BCRD can give us a better idea of exactly what kind of side effects are happening and in how many patients, and most importantly, in who are they occurring, such that when you're making decisions about new treatments, you can have as much information as you need. We're available to be contacted about any questions you might have about your biologic drugs, and you'll find the details of how to contact us in your newsletter. Have a good day.